All right, good morning. So I'll start off by saying for all the residents, you get 5 years to prepare for this. I don't care when you start, you're going to feel like you're scrambling at the end. You're going to be refining and doing little things to it. But I started back in PGY4. I'm a big fan of hand tools, as weird as that may sound to some. But I read two of the driest books on the history of surgical instruments. And I was somewhat interested in it. And when I started putting stuff on paper, it's like, oh my God, everyone's going to sleep. But you do some of that reading, you start coming across some interesting stories. One of them that I came across, I'm not going to talk about here, was the Bradmore arrow extractor. I would encourage everyone to look that up because it's really fascinating how that came about. But so as I started coming across those stories, I decided, I'll just kind of look up some other interesting stories and try to get stuff that hasn't really come up. It's kind of in the spirit of Legends of Surgery. If you are familiar with that podcast, I don't think any of these came up in that podcast, but it's been a few years since I actually listened to it. And then I know historically residents have tried to make something personal in the PowerPoint. I started 3,000 years ago and tried to avoid that as much as I could. I will briefly talk about West Virginia at the end. Uh-oh. All right, so kind of an overview of what we're going to talk about. First up is a Greek physician named Demosthenes, and what's probably the most difficult patient in history, I suspect. We're going to go over to, after that, the Hippocratic Oath, a non-physician named Jan de Doot, and the origin of the lithotomy position. I think I informally polled several people, and it seems like no one really knows where that term comes from, the lithotomy position. But there's some fascinating history there. We're going to fast forward to Kentucky and a guy named Ephraim McDowell, and what's arguably the first elective laparotomy ever performed. Then we're going to go over to Eduardo Bassini. He's well known as the father of hernia surgery, but I think it's his personal history as being a prisoner of war that not many people know. And I think it was probably pretty pivotal in his career pursuits. And then finally, we'll go back to West Virginia, briefly talk about my hometown and our tie to the first mechanical heart pump. So first up, Demosthenes and the difficult patient. Everyone's had a difficult patient. They're difficult for a variety of reasons, personality incompatibilities, or maybe you have the severity of the disease. Sometimes it's just because the patient's a VIP. And I don't think anyone had a worse VIP than this guy did. So before we go into a little bit of context is important. His patient was Darius the Great. So Darius the Great was the ruler of the Persian Empire at its territorial height back in 522 to 486 BC. And a lot of the information here comes from the histories of Herodotus. So Herodotus was a Greek sort of encyclopedist. He wrote multiple books. This one I think came from book 13. This isn't Greek mythology. This is considered to be like actual Greek history. So that's the time frame we're talking about. And a little bit more context, just to understand like how physicians were in society, comes from even further back in history. And that's Hammurabi's Code, if anyone's ever heard of that. I tangentially knew a little bit about it, but basically Hammurabi was the sixth king of the first dynasty in Babylon. It was 1,000 years before even the story I'm going to talk about. But it was kind of in vogue at that point in time to write down your laws, put them on tablets or pillars or something, and send them out through the empire so you could have some sort of unified governance. Hammurabi's Code had 282 laws that survive to today. He talked about everything from marriage to property law, regulated commerce, the trades, things like that, including physicians. And as I was saying, it's relevant to what we're going to talk about, even though it was 1,000 years before, because even in the Persian Empire, they were still using Hammurabi's Code to train new scribes to work on taking it from cuneiform into Persian. So everyone kind of still knew the code, or at least, the educated class did. So specifically the code, the 215 to 223, talk about physicians and how they're paid and somewhat regulated. But you don't have to read all these. But the takeaway is there's three classes in society. There are citizens, freedmen, or former slaves, and then there are slaves. The takeaway is if you treat a citizen, you get paid more. If you treat a slave, you get paid less. So it's kind of analogous to private insurance, Medicaid, Medicare, or no insurance. So you might think that people just wanted to treat citizens, but the problem is if you had a bad outcome with a citizen, you got your hands cut off. So there was kind of a risk reward assessment to go into that. If you treated a slave and he died, you had to replace the slave. So that kind of dynamic between physicians and their patients in mind. Let's look at Demosthenes. So this guy was born, unknown year. He was born in Croton, which is kind of here in the heel of modern day Italy. His father was both a priest and a physician around the time of Pythagoras. So he had a poor relationship with his father, but it's believed that he got most of his medical training from his dad because he doesn't have any record of any formal medical training. But eventually, because of the poor relationship, he sets off on his own. He ends up going to Athens in modern Greece and working in some of those major cities. Eventually establishes himself as a very respected physician. It's that status that eventually gets him recruited by the tyrant of Samos, which is right here. So that tyrant's name was Polycrates. Now, a little different view of the map. This is depicting the Persian Empire. So starts off in Croton, moves over to Athens, and eventually into Samos. And you can see Samos as well within the Persian Empire here. So Polycrates, the tyrant, is kind of, it's a pirate economy, basically. So the governor of the Persian Empire here is upset by that, and he ends up killing Polycrates. Let me catch my breath here. So after he kills him, Demosthenes is taken prisoner, and that's kind of how Demosthenes becomes involved in the Persian Empire. So at this same time, Darius is working on his expansion eastward, and he's trying to incorporate Greece. But he's just fresh off the losing the Battle of Marathon, and so he's kind of licking his wounds here in the west coast of Turkey. When he's out hunting, he falls off his horse and injures his ankle pretty severely. So his physicians at that time were Egyptian. They were kind of considered the best in the world, the Egyptians were. And they look at his foot and they say it's either broken or it's dislocated. And either way, the treatment is to set the foot. So they do. And you can imagine how painful that was. So now he's lying in bed for like 7 days, can't sleep. Finally, someone in his court says, hey, they just took this Greek physician who's renowned as a prisoner of war. Why don't we have him see you? So in the photo here, this guy kind of looks like Jesus with no shirt on and his foot on a pillow. That's Darius. And the other guy that kind of looks like Jesus, but in rags and chains, that's Demosthenes. So Demosthenes comes before him. It was a really bad break. So Demosthenes comes before him and says, oh, I don't know anything about medicine, but Darius, quote, says, bring forth the scourges and the goads. In other words, he says, well, go ahead and torture the guy. He's not a doctor. So Demosthenes at that point changes his tune and he, quote, says, my training was not exact, but I have associated with the physician and had a passing acquaintance with medicine. So he looks at the foot, realizes, hey, the Egyptians did the hard part. So I'm going to rub some ointment on it and you just rest for a few days. And sure enough, he starts to get better after a couple of days. Darius falls in love with him, basically. Tells him that I'm going to take off your shackles and in its place, I'm going to put on 2 golden chains. Demosthenes is kind of affronted by that. And it's a little bit of an impudent response. But remember, the guy who's writing this was also a Greek. He tells him that, so for me making you so well, you're going to double my pain. And rather than being indignant at that, Darius ends up taking off his chains and making him his chief physician. So he ends up showering him with so much gold. There was a slave that was assigned to do nothing but pick up the gold that spills out of the chest. And that slave goes on to be rich too. Darius ends up intervening on behalf of the Egyptian doctors because Darius was so furious with them that he ordered everyone in the country that was an Egyptian physician to be crucified. So fast forward a little bit, he's the only non-eunuch that's permitted to enter Darius's harem's chambers, who also continue to pay him a bunch of gold. Then he eventually won Darius's wife, Atassa's confidence, and she has a breast abscess. So Darius treats her breast abscess successfully, and then Demosthenes treats her breast abscess successfully. Then both she and Demosthenes go to Darius and say, hey, how about you let Demosthenes go at this point? Darius, hard no. And that was the kind of Demosthenes' whole point in not telling him he was a doctor because he didn't want him to be kept prisoner forever. But he does allow him to join a reconnaissance mission into Greece because he's planning his second conquest. So Demosthenes goes on the reconnaissance mission and then quickly escapes and goes back to Greece. And that's kind of the last we hear about him. Darius, on the other hand, ends up dying. And then if you've seen the movie 300, Xerxes is Darius's son, and he leads the second conquest. And it's where you get to the Battle of Thermopylae. So that's the story of Demosthenes. Like I said, I don't know when he was born or when he died, but the capture of him at Samos was in 522 BC. So nobody's heard of him, I suspect, even though he was the doctor, the most powerful man in the world. But his counterpart, I think everyone has heard of, and that's Hippocrates. He was alive at the exact same time. So from there, we're going to segue into the Hippocratic Oath and Jan de Doot and the origins of the lithotomy position. So we're going to start with the Hippocratic Oath. You don't have to read this. But basically, Hippocrates was the first doctor to kind of move away from divine notions of medicine. He didn't suggest doing sacrifices or praying to the gods to get better. He looked at the body and the diet and tried to keep everything in balance. And so all of his students had to take his Hippocratic oath, and part of it was first do no harm. And that brings me down to this part here. I will not use the knife, even upon those suffering from stones, but I will leave this to those who are trained in this craft. So you don't see that in more or less any of the modern day versions or derivations of the Hippocratic oath. It's because he's talking about bladder stones. So bladder stones have been around essentially as long as civilization has. They tend to form because the bladder doesn't fully empty. It starts to crystallize, and over time, the stones get bigger. So they usually start to form in early childhood. They've been identified in the bladders of mummies as old as 5,000 years ago. And it seems like every civilization, historical civilization, had descriptions of the disease and how they treated it. Everything from the Egyptians to the Greeks to the Hindus, and they were all kind of independent of each other. Some of the things it typically was one of two treatments. You lavage the bladder with some sort of liquid, milk, water, or something proprietary. But the most definitive and gruesome solution was to cut it out. There have been a handful of famous people with bladder stones. The one I'll point out that is kind of interesting to me, Michelangelo. Michelangelo had really detailed knowledge of human anatomy. And so if you go to you see paintings of the Sistine Chapel ceiling, this is the creation of Adam, and you kind of see that God and the angels looks like a brain. And then if you look at the separation of land and water, it looks a lot like a kidney in the renal hilum. And Michelangelo actually died, they believe, from volume overload secondary to obstructive nephropathy. So Hippocrates didn't think that stone cutting was appropriate, but this guy sure did. He coined the term lithotomy, from the Greek for lithos for stone and tomi to cut. This is Aulus Cornelius Celsus. He was a Roman surgeon at the time of Jesus. So that brings us to the lithotomy positioning. So bladder stones tend to settle near the neck of the bladder, both due to gravity and shape of the bladder. And from there, they start to get bigger, they get infected, and they cause bladder outlet obstruction. And all this pressure gets sensed through the perineum. So if you look at the positioning here, typically the lithotomist required 4 assistants. So you'd have the surgeon, you would have 2 assistants, at least one for each leg, to hold them in what's analogous to our lithotomy position now. You had another guy up on top holding the chest and torso down and spreading the perineum. So they would go through the perineum to pull out the bladder stone. So this was all pre-anesthetic. So the name of the game was speed. Just like I'm sure you've heard some of those stories before, but that's a tough area to be quick in. And so there are a lot of complications, especially bleeding, fistulas, and frequently death. The surgery itself was usually reserved for women or children, maybe very young men. The problem is in males, the prostate gets so big that you block access from this approach. And then they were typically a traveling specialty. They didn't stick around town for very long, as you can imagine, just due to the poor outcomes. But one of the quotes was that a good lithotomist needed 3 things: strong assistants, sharp instruments, and a fast horse. So that brings us to Jan de Duke. This guy wasn't a doctor. He was a patient, but his story comes from the physician named Thomas Sydenham. Thomas Sydenham wrote the book you see here. It was just a collection of interesting anecdotes and suggested remedies for various things. His remedies were nonsense. He recommended horse riding for constipation, and for a bowel obstruction, I think it was put a kitten on the belly so that it can both massage and warm the abdomen. What is it? We put an NG in. Let's see the cat do that. So now on to Jan de Duke. This guy had a huge bladder stone. These bladder stones would drive people crazy, literally insane, to the point of suicide. And he had already attempted extraction with the lithotomist twice, and both had failed. So he decided to take matters into his own hand. He was a Dutch blacksmith, so he fashioned his own knife and honed it as sharp as he could. He then sent his wife to the fish market, the most important part of the operation. He called his brother over for some help, and I'm going to read this part. So he told his brother to pull his scrotum aside so that he could grab the large stone in his left hand. With his right hand, he cut into the perineum and did squats to get the wound to open up enough for the stone to fit through. He then reached in with 2 fingers into the wound and pulled the stone out, tearing his bladder in the process. Once the stone was out, he sent his brother for the local healer, who stitched and bound the wound. So pretty impressive story about the guy. It's believed he lived 5 years after he did this operation on himself, and the stone weighed 4 ounces and was analogous to the size of a hen's egg. Now, there are some people who debate how accurate that story is. They think that maybe the first 2 surgeries got the stone out of the bladder and he was just digging it out of the subcutaneous tissues. Either way, hats off to the guy. So this is a portrait of Jan de Duke. The Dutch were absolutely amazed by the guy. He went on, he was pretty impressed with himself too. He went on and had the stone set in gold so that he could tell others about the story. And then he had this portrait done in 1655. This is hanging at the pathology laboratory, the Library of Pathology at the University of Leiden. It's worth pointing out that there are 2 things missing in the photo: a smile and a chair. All right, moving on. We'll go forward a few hundred years to Kentucky. We're going to talk about Ephraim McDowell and the first laparotomy. So he actually operated on a future president, but that's not what made him famous. It was his efforts to save this one young woman's life that he's best remembered for. So Ephraim McDowell was born in Rockbridge County, Virginia. His father ended up moving them to Danville, Kentucky when he was 13 years old. Danville was essentially the frontier at that time. So this is a borderline wilderness doctor at this point. But he goes to Edinburgh to study medicine. And Edinburgh at this point in time was on the level with Vienna or Paris in terms of its medical capabilities. Eventually, he runs out of money, comes back to Danville, becomes a pretty respected surgeon, even goes on to marry the governor's daughter. Now, his most of what I have on him comes from his biography that was written by his granddaughter, Mary Young Ridenbach. And she got most of this from either talking to him, his off boards correspondence with, I guess, the bladder stone story got to him. And the correspondence with other surgeons at the time. So he did a variety of surgeries. He did bladder stone extractions like we just talked about. He fixed hernias. He did C-sections. He even pioneered some work on the inferior maxillary bone. As I said, he operated on a future president, but it wasn't until he got called to see Jane Todd Crawford that he became truly famous. So December 13th, 1809, he gets asked for a second opinion on this lady from her doctors. They believe she was pregnant and had gone well beyond term for birth. And so he rode 60 miles on horseback to see her in Kentucky, and he assessed her and says she has an ovarian tumor. And at this point, her belly's so big that she's not able to eat. She's sort of failing to thrive at this point. She begs him to operate on her just so she wouldn't die. He tells her that, the really good show of informed consent, that the best surgeons in the world for pretty much all of history say that what you're asking me to do is impossible. Everyone dies from this. Heretofore, most people who had even under like the most ideal of circumstances, laparotomy typically led to peritonitis and death. And keep in mind that while they're talking about this, ether day is still 40 years away. So this whole conversation is had in the context of no expectation for anesthesia from the surgeon or the patient. So she continues to beg him, and he eventually concedes and says, if you can come to my house in Danville, I'll operate on you. And she calls his bluff and shows up on horseback, and he proceeds with the operation on Christmas Day in 1809. So he says that as soon as he made incision, all of her bowels eviscerated, and he couldn't put anything back in because the tumor was so large. But he ends up identifying an ovarian tumor. He ligates the ovarian artery in the fallopian tube and extracts it. Took 25 minutes and it weighed 22.5 pounds. Again, this is under no anesthesia and on the frontier. That's honestly not the most impressive part about it all, I think, because while he was doing all this, there was essentially a lynch mob outside his house that was waiting to kill him if things went wrong. So his granddaughter wrote, and I'm going to quote this, while he was doing the operation, an angry and excited crowd of men were collected in the street, awaiting the results of his experiment of, quote, butchering a woman as they expressed it. Had she died under the operation, there was no law in those primitive days sufficiently strong to have protected him from the people. Indeed, his life hung on the recovery of that heroic woman. What nerve, what confidence in God and in his own ability. So Jane Crawford ended up going home 25 days later on horseback, and she went on to live another 32 years. So he was reported to have performed another 12 ovarian surgeries. From one of his op notes, he describes, quote, the tumor appeared in full view, but was so large we could not take it away entirely. We took out 15 pounds of dirty gelatinous looking substance, after which we cut through the fallopian tube, extracted the sac, and weighed 7 pounds and 1/2. In 5 days, I visited her, and much to my astonishment, found her making up her own bed. And then some of the details in his other op reports go on to cite the importance of, quote, the removal of blood from the peritoneal cavity and bathing the intestines with warm water. So he's really an advanced surgeon who was pioneering something pretty impressively without anesthesia on the frontier. He was later honored with an MD, because remember, he just did like an apprenticeship model in Scotland, but University of Maryland gave him an MD. He has a postage stamp after him. It's a little outdated, but if you know the Southern Surgical Association, it's his emblem that's on, or it's his face that's on their emblem. That's what the house was painted to look like at the time he did her operation. And the modern day McDowell House Museum is in the picture on the right. Now, as I said, he did, she was the patient that made him famous, but his most famous patient was actually James K. Polk, who went on to be the 11th president. So Polk showed up to him from Tennessee. Again, failure to thrive, emaciated looking, and this was all because he had pretty large inguinal hernia that was very symptomatic for him. So he operated on him, and shortly thereafter, Polk sent him a letter that his granddaughter in the biography quotes as having bad orthography and worse grammar. However, at this point, he writes this letter here 14 years later while he's a representative from Tennessee, essentially just expressing his gratitude to McDowell and telling him that he essentially owes all of his health to him. So he did bladder stones, he did C-sections, he did all this. He did at least one durable hernia repair. Emphasis on durable, because up to this point, hernias were kind of just a grab bag of what you did to treat them. And most of them came back if they didn't just die from the complications. But Eduardo Bassini is kind of considered, like I said earlier, the father of hernia surgery. And I think we all, or most of us, know that, but it's his personal story that I'm going to talk about now. But I think a little bit of context about inguinal hernias is worth going through. You can read this quote while I'm reading, but it's fascinating with some of the things they used to do for hernias. So they've been described as far back as 1550 BC. The mummy of Ramses V was found to have a massive inguinal hernia. And there have been a lot of different attempts at explaining why hernias happen. Hippocrates thought it was drinking water from a river that was too big or experiencing trauma to the abdomen. Galen, the surgeon associated with their gladiators, he somewhat correctly thought it was just because the peritoneum stretched too much and got through the muscles. He would recommend ligating the sac and then taking out the spermatic cord and the testicle. As things moved forward, the Arabs had influence, and theirs was primary treatment with cautery, and that influenced the Middle Ages a lot in how they treated them. So they would do one of three things. They'd either ligate the sac and cauterize it, not ligate the sac, just cauterize the sac, or if you were really worried about your turnover times, they just cauterized the skin over the hernia. In the late Middle Ages, there was a guy named Guy de Chauliac. He started doing this ligation, but he'd use a golden thread to do it. And since gold was expensive and you didn't trust most people with your gold, he'd leave a little bit of it sticking out. And then once it scarred in, they would pull it out. He'd usually keep them around until it had scarred in enough for him to get his gold back. As things went forward in the Renaissance period, Pierre Franco started advocating the use of a truss and not operating at all. And then as you move into the 18th century, you start to get guys like Auguste Richter, who did a 2-volume treatise on hernias. And then you start seeing names like Scarpa and Hasselbach and Cooper adding kind of their named anatomy to the mix. And eventually it helps that we get anesthesia and antisepsis, and suddenly we can start doing more detailed dissections and attempt more tissue approximation. It's Eduardo Bassini who really starts this idea of creating the tissue repair. So a little bit of context on him. So he's Italian, but Italy, as we know it today, didn't come about until 1870. Prior to that, it was a bunch of cities, city-states, a lot of warring from neighboring countries going on. And it wasn't until this general named Giuseppe Garibaldi came about that the peninsula got united. So around this time, he starts to go to war with the Pope, essentially, to wrest control from the Vatican of the peninsula. And the Pope calls on all Catholics in the world to come and help defend the Vatican. And meanwhile, Bassini is just finishing up medical school. He's 22 years old. And he finds himself in Garibaldi's nationalist army. He has a company of 70 men, and they're marching on the Vatican. And so they clash at they fight at what's known as the Clash of the Villa Glory. And Bassini this guy's essentially an intern if you think about it like that. He gets stabbed with a bayonet in the right lower quadrant and gets grievously wounded. So the Garibaldi's men lose that battle, and Bassini's taken captive. He's not bleeding to death, but he's obviously got a terrible wound. And fortunately for him, they were pretty humane, and they expedited him over to the University of Padua, where he had just finished medical school. So he becomes both a prisoner of war and he's being taken care of by his former professor of surgery, Luigi Porta. The first day or two, he starts getting really, really sick, and he's on death's door until finally his wound starts draining stool. So what had happened, they think, is the bayonet pierced his cecum. He goes on to get a colocutaneous fistula, but lives through it. He ends up being a prisoner of war for about 5 months, and eventually the fistula closes down. He's released from his prisoner status, and he ends up going back into surgery and gets rid of abandons his military pursuits. So he trains as a second assist under Porta for a few years, and then goes on to train with Bill Roth. Who else did he train with? Bill Roth, trained with Lister, and he trained with a guy named Langenbeck in Berlin. And eventually he comes back to Italy, which is now united. It's truly Italy at this point. And he becomes a professor at the University of Padua. So the University of Padua is, if you recall, Andreas Vesalius, the guy who kind of wrote the original Netters, the first one to give us detailed anatomical depictions of the human anatomy. He wrote his book at University of Padua. And then 200 years later, Giovanni Battista Morgagni, the hernia name, he wrote the equivalent book, but on the influence of anatomy on pathology. So it's in this setting that Bassini's now working. He's also, at the same time, he's the director of surgical pathology at a neighboring university called Spezia. So he has access to a lot of corpses. He starts doing a bunch of dissections, and he comes upon the idea of the tissue repair. So he ends up doing his first repair on an actual patient in December 23rd, 1884. That kind of laid the foundation for the modern hernia repair. He went on to later publish what amounts to a case series, but it's 250 patients that he did. He had a follow-up for all but 4 of them for a range of anywhere from 6 months to 5 years. He had a 97% success rate of the durability. So my suspicion is that, well, he never talked about how his fistula and how his injury affected him or affected his career, but I can't help but think that the guy who got stabbed so close to the inguinal canal didn't pursue some of his dissections because of that. All right, we're just going to fast forward to something completely unrelated. So West Virginia and its ties to the first mechanical heart pump. I'm from Webster Springs, Webster County. It's a huge town, home to the only stoplight in the county. That's about all I can say for the map on it. Now, everyone knows the Greenbrier Hotel. So Webster Springs once had something called the Mineral Springs Resort. There are a lot of, if you look at West Virginia, you're going to see a lot of towns with the name Springs in them. There are a lot of sulfur springs around. People used to think they had medicinal powers or healing powers or such. Webster had 4 of them. And so they built this massive hotel here. It was the largest hotel in the state. It had the first elevator in the state as well. People came from all around. It was far more prestigious than the Greenbrier Hotel, which was built 25 years later at White Sulphur Springs. Unfortunately, the hotel burned down in 1925. We had the big sycamore when I was growing up. It was the largest sycamore in the world. It's 144 feet tall and 28 feet in circumference. You can see some people standing at it here. It has since died, unfortunately. Every small town has a festival. We have the Woodchoppers Festival. These 2 guys I went to school with. This is Jason Lenz, or Opie, because of his years. And then this is Matt Koger. Both these guys have done really well doing wood shopping as an exhibition on like Europe and China and Australia. But the World Championship was, when I was a kid, it was the definitive World Championship. Now there are a few other places that host it, but it's usually televised on like ESPN 19 or something. Matt is actually a Red Bull athlete for chopping, if you can believe that. And then he had an article about his family's legacy published in 2013. He was the youngest world champion ever. I would say we're most famous for trout fishing. This is the Elk River proper. This is the back fork of the Elk. If you ever get a chance, it's beautiful there. There's a trout resort a little bit north of Webster. I don't think God brothers are a thing, but my godparents' son is Josh. Josh is an actor. He's done a ton of movies, but the Back Fork and Hunted were both shot in Webster County. If you watch this one, you'll see where we hunt regularly still. And then finally, bring it back to medicine. If you actually Google Webster Springs, you probably won't see anything that I just talked about, but you'll come up to if you go to the Wikipedia page, you'll see this guy, Forrest Dewey Dodrell. He was born in 1902 in Webster Springs. He did undergraduate here at WU and then medical school at Harvard. He graduated from there in 1930, and then he did a thoracic surgery residency in University of Michigan. He went on as the staff in Detroit. So he had a patient in, what was it, 1952 maybe? Yeah, it was 1952 on July 3rd. He had a patient with left ventricular heart failure. He worked with researchers at GM to design what is considered to be the first mechanical heart pump used successfully in open heart surgery. It was called the Dodrell GMR, and it was modeled after the Cadillac E12. That's what I have for you today. If you have any questions, email me. I'll Google them and get back to you.
All right, Fizz, we'll take a couple minute break before Journal Club, okay?